Hi, my name is Christina Ahern. I am a registered nurse working in the acute care setting in Idaho and a graduate student at Idaho State University, enrolled in the Doctor of Nursing Practice Family Nurse Practitioner program. You are viewing this video because you have agreed to participate in the project I am completing as part of my program. You should have completed a survey. If you have not, please go to the link on your screen or in the description of this video. After completing the survey, return to the video. I thank you for your participation in this important project. Cancer is experienced by 1 in 3 people and is thus important to every one of us, regardless of our setting or specialty. The purpose of this video is to increase your knowledge of cancer survivorship care plans, where to locate them, examples of what survivorship care plans look like, and how to use survivorship care plans to improve the care you provide. First, let's start off by defining cancer survivor and survivorship care plan. The National Cancer Institute defines a cancer survivor as an individual from the time of initial cancer diagnosis until the end of his or her life. A survivorship care plan, also called a treatment summary, is a condensed summary of the cancer survivor's cancer diagnosis, treatment, potential treatment side effects, signs and symptoms of recurrence, and the oncologist's name and location. Currently, in 2018, there are over 66,000 survivors living with cancer today in Idaho alone. As Idaho nurse practitioners, you've likely cared for at least one or multiple cancer survivors. The number of cancer survivors is expected to increase to nearly 18 million in the United States by 2022. We will also see the number of Idaho cancer survivors increasing as cancer survivors are living longer after successful cancer treatments and transfer their care back to primary care. It is important for nurse practitioners to understand survivorship care along with managing the patient's comorbidities and health maintenance needs. The treatments for cancer, primarily surgery, chemotherapy, and/or radiation, can have a significant impact on the patient's quality of life and physical well-being. There are many potential long-term effects that are drug-specific or radiation site-specific. Many of these potential effects require ongoing screening for early detection or management if they occur. Additionally, the side effects or toxicities may influence the treatment decisions made that are related to other healthcare concerns of the cancer survivor to whom you provide care. Thus, the information contained in cancer survivorship care plans are a valuable resource to you as a nurse practitioner. In Idaho, breast cancer is the most prevalent cancer. Therefore, I will use examples of breast cancer survivorship care plans to illustrate how they can be used to improve the care you provide. Although survivorship care plans were introduced in 1994, it was not until 2015 that the American College of Surgeons Commission on Cancer added survivorship care plan distribution as a requirement for accreditation. In 2005, the Institute of Medicine's report, From Cancer Patient to Cancer Survivor, Lost in Transition, initially recommended survivorship care plans be created and provided to patients to increase communication between patients, oncologists, primary care providers, and improve the patient's quality of care. However, research indicates that most primary care providers are unaware of survivorship care plans or how to use them. The literature overwhelmingly showed that patients feel safer when they are seen by both their primary care providers and their oncologists, especially if they feel that their providers are communicating with one another. One primary care provider stated about survivorship care plans, "Absolutely critical. Most of the time I have no information when the patient first visits. Without communication between oncologists and primary care providers, cancer survivors' health care was compromised due to the duplication or omission of services. Survivorship care plans assist with this communication. The oncologist's name and contact information should be included in the survivorship care plan so that the nurse practitioner can contact the oncologist if questions arise without having to ask the patient or search for the oncologist's information. Survivorship care plans also save nurse practitioners valuable time researching the follow-up needs related to the patient's cancer diagnosis and treatment. Any patient who is diagnosed with cancer and treated at a Commission on Cancer accredited facility should receive an individualized survivorship care plan from their oncologist or the oncologist team immediately after completion of their acute cancer treatment. It is important the cancer survivor be instructed to present the plan to any healthcare provider with whom they consult. Ideally, the oncologist facility will forward the patient's survivorship care plan to your office along with any other pertinent patient information. The literature shows this does not happen on a consistent basis. Nurse practitioners can request the patient bring in their survivorship care plan so that a copy can be placed in the patient's medical record. Nurse practitioners can request a survivorship care plan from the oncologist's office. If a survivorship care plan was not created for the patient, the nurse practitioner can create one based on the patient's report, being certain that the patient has accurate recall. There are websites that offer survivorship care plan templates. The American Cancer Society website suggests OncoLife's survivorship care plan creator. Lastly, if you have an iPhone, you can download the American Cancer Society's survivorship care plan mobile app. This will be demonstrated later. Unfortunately, this mobile app is only available to iPhone users. The American Society of Clinical Oncology's survivorship care plan is slightly different from the American Cancer Society's survivorship care plan, which may also differ from the patient's cancer treatment center survivorship care plan. However, the minimal requirements include the patient's general information, the oncologist's information, treatment summary, treatment completed, ongoing treatment if any, familial cancer risk, follow-up care plan, and cancer surveillance or other recommended tests. Breast cancer is the leading cause of cancer in Idaho, so let's briefly look at the American Society of Clinical Oncology's breast cancer survivorship care plan. At the top of the template is the patient's general information, including the patient's name, date of birth, phone number, and email address. The next section is the healthcare provider's information, including names and the institution. Then the cancer treatment summary. The treatment summary includes the diagnosis, treatment completed, ongoing treatment, and familial cancer risk assessment. Ongoing treatment, if any. This section includes a list of common additional treatment medications, plan duration, and a list of the possible side effects. The familial cancer risk assessment. Follow-up care plan including possible late and long-term effects that someone with this type of cancer and treatment may experience. Cancer surveillance or other recommended tests such as a mammogram or MRI, and how often. The last page includes a list of issues breast cancer survivors may experience and lifestyle behaviors that may affect the patient's ongoing health. This is just one survivorship care plan example. Each survivorship care plan should be tailored to the patient's cancer diagnosis, individualized needs, and follow-up healthcare recommendations. The American Cancer Society has created a survivorship care plan mobile app titled American Cancer Society Health and Fitness. This app includes the American Cancer Society Survivorship Care Guidelines for 4 types of cancer: breast, colorectal, head and neck, and prostate. The user is able to select the patient's cancer, years post-treatment, sex, and age. With this information selected, the app will direct the user to the American Cancer Society survivorship recommendations. I will randomly choose a patient scenario. As an example, let's look at a hypothetical patient who has breast cancer, is 2 years post-treatment, female, and 59 years old. Select Find Recommendations. The first thing that comes up is the surveillance recurrence, which includes 6 recommendations with a thumbs up sign. Therefore, encouraging the provider to perform these recommendations, including individualized clinical follow-up care, refer for mammography, counsel on signs of recurrence, assess familial history, counsel on endocrine therapy, and conduct a detailed cancer-related H&P every 3 to 6 months for the first 3 years after primary therapy to detect cancer recurrence at an early stage. There are 3 items that are not recommended. These have a thumbs down sign next to them. For the purpose of breast cancer survivorship, routine labs and imaging are not recommended. Referring for an MRI is not recommended unless the patient is at high risk. Imaging or reconstruction. Do not perform imaging on the site of reconstructed breast. Next, there's 1 recommendation for screening for new cancers. There are 12 recommendations to manage symptoms, and 5 things that are not recommended, including the nasal flu vaccination, 6 recommendations to promote a healthy lifestyle, and 3 recommendations for coordination of care. Throughout this video, we have defined a cancer survivorship care plan, and reviewed a breast cancer survivorship care plan template. We've also reviewed valuable resources, including OncoLife Survivorship Care Plan Creator and the American Cancer Society Survivorship Care Plan mobile app. Cancer is a chronic disease and not a death sentence. Cancer prevention screenings and treatments have improved, therefore increasing longevity. As survivors live longer after treatment, they are being transitioned from the oncologist back to their primary care providers. Survivorship care plans are meant to improve the care for the cancer survivor. As Idaho nurse practitioners providing care for cancer survivors, survivorship care plans will save you time, providing you with valuable information to assist you in your care planning and decisions. They provide a guide for ongoing surveillance of risks and promote informed collaboration and communication between you, the patient, and the cancer treatment clinicians. Thank you for watching this video. I hope you found it useful. Please be on the watch for a follow-up survey. A postcard will be mailed to you in 2 to 3 months. Have a great day.